Good morning, student. Hello. In this video lecture, we are going to discuss about the personality disorder. As in your previous class, first year, you already studied about the personality in the psychology, where you are studied that personality is not a term that defines your looks only, it defines the total quality of individual. That total quality includes the moral, responsibility, nature, emotions, etc. etc. And the looks, your physical appearance is the one part of the personality. The personality word is derived from the persona, that means face mask. So we can say the personality is dynamic. Your personality is a total quality of an individual. At different era, the different psychologists define about the personality. Here we are discussing about the few. The first is Allport. Allport says that every individual have their traits. Traits का मतलब होता है क्वालिटी. हर इंडिविजुअल के पास अपनी क्वालिटीज़ होती हैं. आलपोर्ट ने बताया every individual have three types of quality, three types of traits. जैसे कार्डिनल ट्राइट्स. कार्डिनल ट्राइट्स वाले व्यक्ति जिसके अंदर कार्डिनल ट्राइट्स पाए जाते हैं. हियर अल्पोर्ट डिफाइन दैट व्हाट इज कार्डिनल. कार्डिनल मीन्स सम स्पेसिफिक क्वालिटी. जो जिन लोगों में कार्डिनल ट्राइट्स होते हैं, दे आर डिफरेंट फ्रॉम अदर्स. दे आर वेरी डिफरेंट फ्रॉम अदर्स. दे हैव सम स्पेसिफिक क्वालिटी जो उन्हें मीन्स वर्ल्ड वाइड उनकी इमेज बनाती है. वर्ल्ड वाइड वो पर्सनैलिटी फेमस हो जाती है. हेयर वी टुक वन एग्जाम्पल in from our India, such like Mohandas Karamchand Gandhi have a tried of ahimsa. That part of personality उनके इसी क्वालिटी ने, उनके इसी ट्राइड ने उन्हें वर्ल्ड वाइड फेमस किया. अनदर एग्जाम्पल वी कैन टेक्स द मदर टेरेसा. उनमें ह्यूमैनिटेशन जो था, मानवता जो थी, उस ट्राइड ने उन्हें पूरी दुनिया से अलग बनाया. तो ऐसे ट्राइड्स जो किसी व्यक्ति विशेष में होते हैं, जो उन्हें बहुत फेमस करते हैं, दैट ट्राइड्स वी अकॉर्डिंग टू अल्पोर्ट वी कंसिडर्ड एज द कार्डिनल ट्राइड. Central traits, that means the person individual traits such as behavior, intelligence, these are considered as central traits, which everyone have the central traits. Central traits make them the social stability. How does that person handle the situation? That are the central traits. Includes behavior, sociality, etc. And the Alport says the third one is secondary traits, which we consider the looks, physical appearance. In this same sequence, another psychologist is Kettle, which we considered in your notes. You can see there Kettle. Kettle defines that the person may have two types of traits. According to the Kettle, person may have two types of traits. One is root traits. One is root traits. Another one is surface trait. Surface traits. In root traits, the Kettle says the root traits, that means nature of a person, behavior of a person. Okay, and the surface traits, the Kettle says it's define your looks, your expression regarding the emotions, etc. And so many psychologists are there. Those are define your personality in different terms. So next we are discussing how your personality grows. There are यहाँ पे एक बहुत फेमस लॉ है that defined by the Sigmund Freud, that is called the psychosexual development theory. That helps to develop you, that helps to develop a individual in the various stages. That is, you can see in this diagram, that also you can studied in first year. The psychosexual theory says the whole development of an individual is in the five stages. Here we are zooming that. These 5 stages are oral, anal, phallic, latency and genital stage. That here in the second column we mention the ranges of that. Is oral stage is considered in the age between the birth to 1 year. Here the person is completely, जो यहाँ पे principal organ होता है that involve in that is mouth, and person understand how to suck, how to chewing. If that we will discuss later, if that stuck in this stage, what will happen? The fixation on this stage may result in the immature manipulative personality, which is having the orally passive, like smoking, eating, kissing, oral sexual practice, etc. The second stage of that, anal, in which considered the age of 1 to 3 years, that principal organ of this stage is bowel and bladder. In this uh, person may go through the toilet training and etc. The third stage is phallic stage, that is called phallic. Phallic stage is ranging from the 3 to 6 year. Here the principal organ of genitals. Here one important question is, in the phallic stage may examiner ask to you that Oedipus and Electra complex. यहाँ पे क्या होता है in the phallic stage, the child, जो growing child है, that attracts to opposite gender. If a boy child is there, that attracts to her mother, his mother, and if a girl child is there, uh, she may attract to her father. The Oedipus complex, that attraction is called the Oedipus and Electra complex. In girls it is called Electra, and in males it is called Oedipus complex. Next stage आती है, that is latency stage, that is 6 to up to your puberty, जब सेकेंडरी सेक्सुअल करेक्टरिस्टिक्स डेवलप होते हैं. यहाँ जो डोमिनेंट ऑर्गन होते हैं, दीज आर सेक्सुअल. और इस स्टेज में जो चाइल्ड होता है that participate in the same sexual peer group. And the last stage है genital, that is after the puberty जो stage होती है. यहाँ पे mature sexual interest mature होता है, means person wants to take some initiative to talk with other opposite gender or interested in opposite gender. These are developed in the genital stage. Okay, next we are going to discuss about the personality disorder. If if we are going through the personality disorder, first we are discussing about what are the main causes of personality disorder. The first one cause is genetic, second one is biochemical cause, in that increased level of testosterone found in the affected persons, ऐसा देखा गया, studies suggest that. And the third main cause है psychological cause, include the unsatisfactory development during the psychosexual development. Psychosexual development we discuss in this slide. If some persons are fixed in some particular stage, the particular fixation develops in that particular person. Next we are discussing some facts about the personality disorder. जो personality disorder होते हैं उनका onset acute होता है, they are early onset, and sudden onset होता है. More stable than other disorder, they are more common, more stable than the other disorder, maybe for lifetime. And the commonest personality disorder is avoidant. Here we can consider that in females most common uh, personality disorder is histrionic personality disorder. In males it is avoidant. If we are talking about the commonest personality disorder, that is only the avoidant. If examiner asks the particular about the females, that is histrionic personality disorder. Next we are going to discuss about the types of personality disorder. First we are discussing about there is so many disorders related with your personality. First, it is the paranoid personality disorder. Here I define all the disorder types by a particular one word. Here the paranoid personality disorder is defined by the suspicious nature. You can remember that the paranoid personality disorder person is very suspicious. He looks tensed. He looks tensed. Okay, that person is unable to confident in other, होल्ड ग्रेजेस, बहुत ज़्यादा शिकायत प्रवृत्ति का होता है, बहुत सारी ग्रेजेस होती हैं, उसको बहुत सारी कंप्लेंट्स होती हैं. दैट पर्सन फीलिंग इंसल्ट इन द सोशल इवेंट्स. कॉमन कॉमनेस्ट टॉक आर टेकिंग एज ए वार्निंग. आप बहुत सिंपल सी बात उसे कहते हैं एक कॉमन लैंग्वेज में ही, और वो उसको एज ए वार्निंग कंसिडर्ड करता है. These are the signs symptom of paranoid personality disorder. You can understand the paranoid personality disorder by one word, that is suspicious nature. Okay, the next personality disorder is schizoid personality disorder. Schizoid personality disorder वाले person अकेला रहना ज़्यादा पसंद करते हैं. They like to live alone. Other sign symptoms include comfortable in the activity that does not need any company. अकेला खेलना बैठना पसंद करते हैं ज़्यादा टाइम. दे स्पेंड मच मोर टाइम. ओनली फ्यू एक्टिविटी प्रोवाइड प्लेजर, सच एज अकेले खेल रहे हैं तो उनको प्लेजर अच्छा आएगा, और ग्रुप में नहीं इन्वॉल्व होना चाहते. इमोशनली दे आर वेरी कोल्ड. वेरी लिटिल इंटरेस्ट इन द सेक्सुअल एक्टिविटी. ओके, so it's, you can remember the schizoid personality disorder are like to live alone. Here we mention that one word. By that you can define the schizoid personality disorder, that is they are happy to live alone. The next one is schizotypal personality disorder. They showing the eccentric nature. That means they are very you can say, in Hindi you can say they are that type of person are very having the odd belief, having the lack of friends, having the social anxiety, having the magical thinking, they having the particular thought process. Eccentric, that means sunky. Okay, these type of persons are showing the sign symptoms like eccentric behavior. ठीक है, पर्टिकुलर उनका थॉट प्रोसेस होता है. दे हैव सम फिक्स्ड बिलीफ. दे आर हैविंग द मैजिकल थिंकिंग, लैक ऑफ फ्रेंड्स एंड द social anxiety. The next type of disorder is antisocial personality disorder. Antisocial personality disorder you can understand by the some persons those are not follow the norms of society, disagreed with the social norms. सच जैसे हमारे पास एक बहुत कॉमन एग्जांपल है, जो टेररिस्ट होते हैं. दे आर नॉट, दे ऑलवेज डिसएग्री विद द सोशल नॉर्म्स. ओके, ऐसे पर्सन क्या साइन सिम्टम शो करते हैं? दे आर मोर एग्रेसिव. उनका टॉलरेंस पावर बहुत कम होता है. दे आर डिसेबल टू मेंटेन रिलेशनशिप. इररिस्पॉन्सिबल होते हैं. ठीक है, ये सारे साइन सिम्टम्स किस में दिखाई देते हैं? एंटी सोशल पर्सनैलिटी डिसऑर्डर में. द नेक्स्ट वन इज हिस्टेरिक पर्सनैलिटी डिसऑर्डर. इट इज मोस्ट कॉमन डिसऑर्डर दैट इज फाउंड इन द फीमेल्स. ऐसे पर्सन्स क्या होते हैं? दे आर अटेंशन सीकर्स. दे आर अटेंशन सीकर. दे फीलिंग दे they feel discomfort when do not find themselves in the center. They always be want कि they must be in the center. Okay, they are very talkative. They are very talkative in nature, but lack of details. React quickly. These persons are react quickly. They use plenty of makeup for attraction. They always in dramatic behavior and activity. Okay, the next personality disorder is Narcotic disorder, you can correct that spelling, that is NAR double CCCITIC, narcissistic personality disorder. That personality disorder have the grandiosity, okay. These are have the grandiose thoughts, always be in the dreamy environment. They have the a grandiosity of relation with VIPs, always have like to hear good for self, ठीक है. They have the sense of entitlement. They always thought that what is happening surrounding them, वो ही उसके लिए रिस्पॉन्सिबल हैं, जो अच्छा हो रहा है उसके लिए भी वो ही रिस्पॉन्सिबल हैं, क्रेडिट लेना चाहते हैं. दे यूज़ अदर फॉर सेल्फ इंटरेस्ट एंड एम्पैथी मिलती है उनमें. दे आर इमोशनली ब्लाइंड. ओके, this is all about narcissistic personality disorder. Next one is borderline personality disorder. They having the unstable mood. They always be irritable, ठीक है. मोस्ट कॉमन जो फीचर है इसका, दैट इज सुसाइडल टेंडेंसी. मोस्ट कॉमनली कौन से पर्सनालिटी डिसऑर्डर में मिलती है? इफ एग्जामिनर आस्क यू दैट, तो सुसाइडल टेंडेंसी किस में मिलती है? बॉर्डर लाइन पर्सनैलिटी डिसऑर्डर में मिलती है. सुसाइडल टेंडेंसी, ओके. सुसाइडल टेंडेंसी मोस्ट कॉमनली सीन इन द बॉर्डर लाइन पर्सनैलिटी डिसऑर्डर. अनस्टेबल सेंस फॉर सेल्फ, uncontrolled temper. They have the self destructive behavior, impulsive behavior during sex, driving etc. बहुत तेज ड्राइव करते हैं, है ना, अचानक से इम्पल्स आते हैं. frequent breakups in relationships. These are the sign and symptoms of borderline personality disorder. नेक्स्ट वन आता है, नेक्स्ट वन इज द अवॉइडेंट पर्सनैलिटी डिसऑर्डर. यहाँ पे मोस्ट कॉमन जो आप वन वर्ड अगर अवॉइडेंट को डिफाइन करना चाहो, दैट वर्ड इज एंजाइटी, ओके. अदर साइन सिम्टम्स मोस्ट कॉमनली इंक्लूड द fearfulness, fear of strong relationship. They have the fear of rejection, social phobia उनको होता है. and these pupils किसी से मिलने से पहले वो ऐसा सोचते हैं कि वो उनको रिजेक्ट कर देगा. दैट टाइप ऑफ एंजाइटी दे हैव, ओके. नेक्स्ट डिसऑर्डर आता है डिपेंडिंग पर्सनैलिटी डिसऑर्डर. as the name shows that depending personality disorder, that means that these person are depending on other, unable to take decisions, even day-to-day life activity, difficulty in expressing themselves, fear to lose the relationship, frequent changes in relationship, feel helplessness in the a lonely situation, lack of confidence they are completely depending on others for their day-to-day life also, okay. These all are the signs, symptom. And the next and last, that is obsessive compulsive personality disorder. This type of personality disorder persons are highly regular, they are punctual and perfectionist, ठीक है. They are excessively dedicated to the work, rigid behavior. They can't adjust with any situation. They showing the rigid behavior, unable to distracting work responsibility, unable to distribute work responsibility. वो centralize रखते हैं सारे काम को, distribute नहीं कर पाते. lack of sense of humor, lack of IPR, okay. These are the signs and symptoms of obsessive compulsive disorder. So here we are discussing the 10 types of obsessive compulsive disorder. Next we discussing about how to manage the personality disorder. We can manage the personality disorder by the group and individual therapy, ठीक है. that we will discuss in the psychotherapy chapter, Milieu therapy. and they can pharmacologically managed by the antipsychotic drugs, antidepressive drugs. Here we just mention a note that safety is highest priority during the care of personality disorder patients. Okay, that's all about the personality disorder. You must keep your notes in front of you during the study, and if you have any doubts, you can contact me. Thank you, students. Thank you.